All right, y'all, good morning. Today is December the 7th. This is day 7 of VLOGMAS. There go my hubby, Mr. Chris. And as you see, we are still in the hospital. So, it's my little caretaker, my husband. But anyway, y'all, I didn't vlog yesterday because I was hurting. I had the bronchoscope done yesterday. You look so cute. And this IV keep oh, thank you. But anyway, y'all, I had that bronchoscope done yesterday. Tell them, baby.
She was on a lot of pain.
And so one of the nurses come telling me normally people don't have that much pain after bronchoscope. I'm like, well, this is your first time seeing it, I guess, but that hurt. So, well, let me tell you why it probably hurt the worst. They sent me down, I hate to say it, with a faulty IV. The catheter was not in my own right, so when they go to give me my medication, they gave me fentanyl and Versed. They told me it was going to be like a mild relaxation. I didn't get any relaxation because my medicine came out as soon as it went in. They gave me another dose. Still, I saw everything, I heard everything, and I felt everything. So, that went south. He say when he went in to clip the first sample, I had some oozing in my lungs, so that stopped. And, you know, long story short, I just felt everything. So when I came back to the room, I was in excruciating pain, y'all. It was horrible. So, you know, doctor apologized. He felt bad, but it really wasn't his fault, you know what I'm saying? But I feel like they should have tried to adjust the IV, and I shouldn't have had to go through that, but it's all G. I'm a warrior, and I got my man here, so, you know, we worked it out. But other than that, I was in a lot of pain yesterday. They had to give me PRN medication. They gave me oral medication because, you know, the faulty IV, which they did come change the IV. But what you call it, too little, too late. Ain't that how you say it? You know, the damage was done. But anyway, that's neither here nor there. I'm feeling a lot better today. I still have to have some pain meds because when I cough, I can feel it getting hurt, or if I exert my body too much, I feel it. But other than that, you know, I pretty much can control my pain and, you know, dictate how I feel. Yeah, you'll put that bag up. So I decided to get up this morning and straighten myself up. Yeah. Make myself look feel better. I did another one of my no makeup looks. Just try to brighten my skin up. And I put this little wig on. But anyway, so the doctor said yesterday that I'll probably go home today. I'm not sure. He said it takes about 3 to 5 days for the biopsy results to come back. I don't know. Hopefully they don't keep me any longer. I really don't want to be in here all weekend. But if it's best, you know, if it's treatment I need, you know, if the doctor feels it's best, I'm willing to do that, and I'm willing to stay. But other than that, if I can go home, that'll be great too. I noticed since I've been in the hospital, I mean, my wheezing is still there. I wheeze real bad still, but I noticed the coughing is less. Right, baby? You know, the coughing is less, and I just don't want to go home and get the feeling bad again, you know. So I'm willing to stay and finish the course of my treatment. But yeah, and I'm not sure what we got going on today. I told my mom I didn't want her to come up here today because I'm supposed to be leaving, but she told me the other day because you know how moms can be. She want to come no matter what. So, you know, I'm trying to prevent her from coming up here. Chris ain't finna go nowhere. I tell them though, y'all go chill out because you know caregivers have to take care of themselves also before they get burned out. But anyway, if anything interesting happens, I'll pick up the camera again. But you know, we really can't do much vlogging. Like with the doctors and stuff, they big on the HIPAA. So I don't know, maybe I can show y'all my lunch or something. Whatever they bring me for lunch. I can't. I know, cut that out. Oh yeah, and so when I got back from my bronchoscope yesterday, they told me I shouldn't cough up any more than a quarter cup of blood, which it wasn't a quarter cup. And I didn't feel the scope going down, but this morning, oh, look at my ashy hand. I'm gonna lotion myself down. But this morning I noticed that my throat just feels a little irritated. It's not hurting or anything. It just feels a little irritated, I guess, from the scope. But they numbed it real good. The lidocaine that they used to numb my nasal cavity and my throat, that worked. But as far as calming me down and the pain from the biopsy, that was a no-go. That was a no-go, y'all. So, anyway, like I said, if anything interesting happens that I can talk about, or if I leave, I'll come back. All right. See you guys later. Yeah. So, how y'all been liking the little, I gotta stop chewing that gum so much too. How y'all been enjoying the last couple of VLOGMAS that I put out? Hospital edition. I see I want y'all to go check out that video the kids did. That was a pretty good video with them taste testing their snacks. That was a good one. And you know, I put a couple vlogs out. I think that was what's today say? At 5 and 6 were hospital related because I'm in the hospital. Maybe I can get the kids to do some vlogging at the house, showing them. Well, I don't know, should I do it with them wrapping gifts? Because then my people gonna know what they got. So, I don't know, maybe they can do some stuff at the house. We'll see. I'm gonna call CC in a minute and tell them to get them some footage at the house. Because it is a rocky life, so that consists of my family as well. And maybe I'll scary trip to get y'all a throwback. You gonna get my throwback, baby? I got some throwback stuff at the house. We used to record mukbangs and stuff. Maybe I could put a mukbang on there. We got some videos though. But anyway, what you watching on TV?
I've been going through the channels.
It's Saturday, you know, nothing on me on TV. They be having like a lot of college games and stuff on. I used to hate when I was young. Oh my God. On Saturdays, I didn't do football and basketball, which I still don't do no college stuff. But I barely watched the NFL, NBA. But they used to show all that college stuff, and oh, they used to be so depressing once the cartoons go out. And NASCAR was big. They showed a lot of NASCAR and volleyball too. I don't know why, it just was a sports day. Yeah, but I don't know, I'm just gonna chill out and probably catch me a nap. Who knows? it seemed like baby was just saying that most of the foot traffic is at night. You got, I had 2 breathing treatments last night. I get medication throughout the night. Who else came last night? Respiratory, my nerves, the CNA's getting vital sign, lab, collecting lab. So I see most of the people at night, like I barely see the morning nurses. I mean, my CNA been in here. You know, she real good. But I don't know. Not so much with my morning nurse. I ain't so calling no names, but she need a little bit of work. You know. But I ain't gonna go into that. I go into that on my nursing video. Oh yeah, by the way, y'all. Well, maybe I still should wait till when I start dropping my video. Should I go and tell them the name of my nursing page? So I get some videos posted. Okay, so Chris say wait, y'all. But anyway, I'm gonna go and try to get some stuff. I made that video on that telemetry monitor. I may put that out today, but I'm gonna have to go do a voiceover and this and that. But I have the monitor on right here, and you know this is how they normally do it. They keep it in your pocket. It ain't really. I mean, I like to sleep prone, y'all, and so it get in the way when you land on your stomach. But other than that, like I told y'all, it's some stickers they put on you and the electrodes. But this is a five electrode thing. We have 3s and we have 5, and actually you can have 6. So well, I know in my job we have 6 and 3s. So yeah. My IV. I may have to change it again. Nobody thought to ask me if I was left-handed or not. It seems like I'm complaining, but it is what it is. Nobody thought to ask me if I was left-handed or right-handed, and I'm a lefty, y'all. Shout out to my lefties. But I'm doing a lot of movement with my left hand because I'm a lefty, so it's causing my IVs to act up. So I'm going to tell them if they come back, they probably want to go on the right side. I think that'll be a smart idea. I may cut all this out, but, you know, just putting it out there. But anyway, guys, like I say, I'll get back with you a little bit later. Hey, y'all. So, right now it is about 10 minutes after 2. My respiratory therapist just left, and she was like, wait a minute, is that my patient? She said, you done glammed yourself up, honey. I said, it wasn't that bad. And we started laughing. But, you know, it's good to have people you can laugh and talk with. But anyway, my doctor did come in, and he told me that I'm not going home today, so I'm not discouraged or anything, because I ultimately want to get better, but it'll be probably tomorrow or the day after. But I just want to check back in with you guys and say hey and let you know what's going on. I did go down to have a CT scan done, so I'm waiting to see what the nurse has to say about that. And I'm about to call her, actually give me something for pain, or either something for this coughing. Well, probably pain because it hurt when I cough. But yeah, we'll go from there. Alright guys, I'll talk to y'all later. Okay y'all, so this the kind of stuff that's starting to piss me off about being here. Okay, I talked to my doctor earlier today. My pulmonologist, he was very sympathetic about what happened, empathetic I might say, about what happened, because he know when I went down for my procedure, they didn't give me my proper medication, and I'm literally in this place hurting right now. I called my nurse at, it was about 2:50 and asked her to bring me some for pain. She came back to the room trying to feed me some BS about she can't give me anything because the doctor canceled it. Well, first of all, I need to know why the doctor canceled it. I don't know this doctor. This doctor just came this weekend. So my thing is, you don't know me, doctor, and I don't know you, but you let my medicine fall off. So I told her, you need to go get on the phone with that doctor and see if you can get my medicine added back on. If that doctor is unwilling to do it for you, that doctor needs to come talk to me. Now, the thing about it, I don't disclose my nursing to nobody. I don't disclose it. But my thing is, you're not going to tell me that you can't give me something for pain when I'm down here painting. You come check my vital signs. My vital signs are elevated because, one, I'm hurting, and two, I'm mad because you're trying to tell me you can't give me nothing. And I know how the game goes. I know how it works behind the scene. I know that they undertreat black people with pain medications also. So I'm waiting to talk to somebody about this because you cannot determine my pain level and you cannot deny me a pain medication. If I'm having over 7 out of 10 pain, you're not fixing to give me Tylenol for my pain. You took away my coughing pills. You take away everything that I had on here. I hadn't heard from anybody. The time is currently 3:35. I went down for x-ray earlier when I told y'all. I went down to x-ray. They take my telemetry box. Tell me why the box sitting here. Nobody here is held responsible for the things they do. You know, you should have put that box back on me to monitor my heart. I've been in this room. I have to go back and look and see when I last talked to y'all. But I've been in this room all this time. They didn't hook me back up to the box. It's not my job to do that. It's not my job. I'm off. I'm in the hospital. I'm paying them good money to be here. My insurance is paying good money. I'm going to have a great copay I got to pay. So I expect to be treated. I've been sitting here over 40 minutes now, waiting on her to get back with me. She hadn't followed up. She's not good as being a patient advocate. She's not good at being following up with her patients. I'm still not going to disclose her name, but I just want it to be known that she's a pretty crappy nurse. She's very horrible. So I'm gonna call back down here and see what transpired between the doctor and my nurse. So I hadn't heard anything. Like I say, it's been over 40 minutes. So we'll see why he's not here yet and why haven't I heard anything. I'm sorry. Yeah, can I have my nurse down here, please?
Okay, let me see who that is. Okay, she's not behind the desk. Can we do something for you?
She was supposed to have been following up with my doctor, and I need to know if she talked with him. Can he come to my room? Because I need to speak with somebody.
Okay.
So I'm quite sure you guys heard. They picked up the phone saying, what was it? I'll go back on it. But anyway, we'll see what they say. Let me stop rocking in this chair. I'm just gonna see how long it takes them.
3 minutes in right now. Yeah, I'm very frustrated right now. I'm very, very frustrated. I don't know why I knew this was going to happen. And I don't think it's right.
I'm gonna leave my camera on. You know, I sat here and I waited. And you know, I was hurt before you left.
Yeah.
So I did finally call the girl and told her to send me something for her.
Yeah.
So she came down here.
Don't get upset too hard.
Well, I'm be honest, because I've been sitting here this whole time since. I've been sitting here this whole time before you left.
Yes.
So she come out here trying to tell me, oh, well, unfortunately, your doctor canceled the medication. This nigga who I don't even know, who came here and barely listened to me. So I'm like, what did he cancel my medicine for? She like, I don't know. So I called. No, I was like, well, what about my Tesla? She told me he canceled that too. No, he didn't cancel the Tesla. He canceled the Tussin X. And I'm like, how he gonna cancel all this and he don't even know me? So I told her, well, what you need to do, you need to go down there and get on the phone with her and get him to reorder my medication. I said, if he don't want to listen to you, I need him down here so I can talk to him. Because, like I say, he don't know me.
I don't even know him neither. I never seen him.
He don't know me. He's just a weekend doctor, apparently.
But I said,
What?
I said, no, he come my way out. He was in the room down there with somebody.
Okay, so.
Let me wash my hand too while I'm talking.
You know, my thing I've been sitting here all this time.
Yeah.
I'm just getting worked up as I'm sitting here because I'm like, I know I don't call for that.
You don't.
I call for the pain medicine when I need it. Yeah. And my thing is, who is he to take it? And then second of all, I'm getting pissed off because I'm thinking about the fact you sent me down here and I had this fucking procedure done and I wasn't even medicated over this fucking IV. Exactly. And you come here.
And try to
tell me I don't have no pain medicine and all that time. Like I say, I've been waiting over 40 minutes on her to get back with me. I just called somebody. And I'm like, I need to talk to my nurse. Oh, well, shit. Well, first of all, they picked up the phone. I got it on recording because I'm vlogging the whole time. They pick up the thing, like, I don't know if it was what or what they said. Yeah. And then they like, she ain't at the desk. And I'm like, I need to find out what's going on with my doctor. Yeah. I want these down here, tell them I'm down here. And so, you know, my thing is, I'm in pain. I don't have to lie about my pain. And like I say, it's been over 45 minutes since I heard from her. She don't try to follow up or nothing with you. And I don't think that's right.
She don't know what that. You know what? They sorry. I'm looking at them because I go down to the little lady that gave me the coffee. I'm like, hey, how you doing? She the only one at the nurse station. I say, hey, how you doing? Since she works, I'm just so tired. Got her head on the desk. So she said she was in room 26 or something, passing out some meds. And so by that time, here she coming out right the corner. I'll be down there. I'm working on it. But you can tell she don't know what she's doing either. She don't know what she's doing. A lot of them.
Did you ask?
Later, the one I said, phone to give me a call because she said she just talked to you. The 27 one walked her from down the hallway and then told me she working on it. She'll be down there.